Good afternoon, everyone. Or is it good morning? It's afternoon now, is it? Nice to be here. I had planned to be here last night to join Ed John and a number of other delegates for a meeting, but I was not able to be here due to the motion to have an emergency debate on the H1N1 last night. So nice to be back in British Columbia. I've been coming here quite regularly to meet with tripartite group discussions. And every time I come here, I think of what journey we took in the North to create our own territory, our healthcare system. And I get excited about that because we've gone through it, we're still dealing with it, and I see my former ADM sitting here, so he can give you some of the insight into some of the challenges that we faced. But ultimately, in Nunavut, we had our own territory. We're 10 years old this year, so it's exciting times, I think, for people in British Columbia. So chiefs and councils and health directors, federal and provincial colleagues, it's an honor for me to be here. I'd like to thank an individual who introduced me, who I run into more, I think, at airports than at conferences for his kind introduction. It's both a pleasure and an honor, again, for me to be here with all of you today at the Gathering Wisdom. And again, this conference is important and represents an opportunity for us to reflect on what we've achieved over the past few years, while also looking ahead in terms of what is possible for real change in the health of BC First Nations. This is why I'm particularly pleased to be speaking to you about health governance and the role that it can play in better health and better health systems for British Columbia First Nations. H1N1 has shown us how important tripartite collaborations can be in dealing with new and emerging health issues, and a strengthened role for First Nations in the management of these issues. Our success now and in the future will depend on how effectively we work together. Because of this, I am particularly excited that we have this opportunity to share ideas, provide updates, and seek the input from communities on how to best implement the British Columbia Tripartite First Nations Health Plan. The management of H1N1 for BC First Nation demonstrates how well the tripartite approach to healthcare is working. Since it was formed in July, a tripartite H1N1 Health Partners Group has been proactively responding to the pandemic in British Columbia. This group, co-chaired by 2 First Nations physicians, has also developed an action plan for remote and rural First Nations communities to address their unique needs. As we deal with the second wave of the pandemic, we are confident that the close working relationship between the federal, the provincial, and First Nations leadership in British Columbia will help us to continue to manage the situation and minimize its negative consequences. Like many here today, I am from a remote community. I understand the challenges that Canada's First Nations people face when it comes to healthcare. And that's why the Tripartite First Nations plan is so important. This partnership demonstrates our shared commitment to working together to improve services, health promotion, and disease prevention initiatives. The tripartite plan also calls for major change in the way in which the health system is governed, by giving the First Nations a much larger role to play. Significant progress has been made to improve health services for First Nations since this plan was first introduced. Regional health authorities have developed Aboriginal health plans, and Dr. Evan Adams has been appointed as the Aboriginal health physician advisor to the Provincial Health Office. Dr. Adams has been a powerful advocate for the First Nations people of British Columbia since he was appointed to that role a little more than 2 years ago. His understanding of both medical science and the cultural history of Aboriginal people gives him a perspective that has been instrumental in helping us develop the tripartite agreement. Dr. Adams has also been co-chair of the tripartite H1N1 Health Partners along with another First Nations physician, Dr. Shannon Waters. We must give them credit for the great work they have done to help First Nations communities prepare for the second wave of the virus. By helping in the response to the needs of the moment, they are laying out the groundwork for a new healthcare partnerships with greater control by First Nations. I believe this will lead to long-term improvements in healthcare.